Ready?
Yes.
So, somebody asked me to mention the involvement of other companies, American companies within the NHS. So we have Health Corporation of America, which is a big provider. It's a hospital chain predominantly. It's a provider rather than an insurer. They have a major facility in the Shard in London, very quite right next door to Guy's Hospital. They also run a ward within Guy's Hospital and also UCL in the cancer centre in the UCL. They are already there, so people who having to wait longer or are now actually denied some cancer treatments can just go upstairs, pay for it with HCA. So we already have a two-tier system within the NHS. HCA were found to be committing fraud by the FBI when they did a sting in Florida, and they found that HCA's 50% of the coronary angiograms they were performing and stents were not necessary. 50%. And the doctors and nurses were changing the records retrospectively to justify the procedures and billing the insurers. So not only was that fraud, but also grievous bodily harm. There's a 1 to 2% risk of death doing those procedures. And HCA are embedded within London. Centene is another company, it's an insurer, and they are heavily involved in Nottingham and the setting up of the ICP ACO in Nottingham. So and that's not to mention the other companies like G4S, Serco, who are providing ancillary services, ambulances and all the rest. Another question about think tanks. So you have to admire how clever they've been about this. On the one hand, you have the selective reporting on the media, and then you have another big component, which are the think tanks, which give the appearance of a third neutral party joining the debate. But if you look at some of the think tanks are blatantly right-wing and funded by, well, we don't know who they're funded by a lot of the time. I'm talking about the Institute of Economic Affairs and Reform. So they blatantly have a free market agenda, but that also includes King's Fund and Nuffield Trust, who Simon Stevens was involved with. And one of the King's Fund's main men, Professor Ham, has been cheerleading for HMOs for at least a decade. And I might be able to say a bit more about Chris Ham. You've got some direct quotes, haven't you, from Chris Ham? And then you have the other salesmen for all of this cashing up along the way are the big four accountancy firms, which offer consultancy services to hospitals in terms of restructuring. But they were also the big instigators for PFI. So every PFI deal that went through had the fingerprints of one of the big four accountancy firms. I'm talking KPMG, Deloitte, Ernst & Young, and the fourth one I forget. PwC, thank you. So they cash up on the financing. They are brought in to push through reform in the face of opposition. The bloated management structure that we have don't actually perform any of the nitty-gritty. They get external consultants in. You couldn't make it up. Direct action. Yes, I think it's time for direct action. I'm contemplating engaging in some myself, but I have to also be careful about being neutered. There's a chap called Chris Hedges. I don't know if you've heard of Chris Hedges. He's a journalist, he's an American, and he warns where this is heading in terms of corporate state fascism, where the corporations dictate every policy, and our politicians are really just a smokescreen for what's going on. What I've shown here is a book that I found very helpful, which shows the links between the right-wing lobby groups and think tanks in America and our own in this country. Democracy in Chains by Nancy MacLean exposes a lot of how this came out in the 50s and how it's matured over the years, and how big money such as the Koch brothers have been steering not only policy but also altering the fabric and philosophy of their higher educational institutions. So economics, for example, is dominated by the neoliberal model. There's no other game in town. Yes, direct action. You know, you need to come up with some ideas. I don't want to... it's got to be within the law. But I think we need to put pressure on the people who are selling us out. Yeah? The people on the CCG boards, the GPs who are heading all this up, they're providing a smokescreen of clinical, giving it a rubber stamp. You know, where are these people's surgeries? Go and petition outside, go and do a sit-in, go and let them know that you know what they're up to. The hospital boards that are busily forming partnerships with whoever comes along, they need to know that the public are waking up. So there's plenty of scope for direct action. Be a bit inventive, but simply marching around on a Saturday causing nobody any disruption is great for networking. It's a great morale boost. I go along. Does it achieve anything if it doesn't get reported? No. The yellow vests have been going for 6 months. How much do we hear about it on mainstream media? Zero. In fact, one of the waking up moments for me was I went along to one of my first marches in Manchester in 2013, outside Tory party conference. There were 50,000 people there. I rang my wife up, I said, don't go to bed. I'm going to come over, when I come back home, this will be all over the news, and it'll be a game changer. Zero. And then what's going on? What else don't I know? So yeah. The other actions, I'll come on to other actions if somebody asks me later on. Section 75, so somebody's asked for clarification about Section 75. If you leave the Health and Social Care Act in place and you do not fully renationalise the NHS and fully remove the toxic private sector, then simply removing Section 75 enables the monopolisation within the NHS, enables taxpayers' money to go through the siphoning hands of the insurers. So you need to first renationalise. The other thing with part privatised public service, it comes into the remit of trade deals. Trade deals, to me and you, may be about selling manufactured goods. No, it's about access to public service budgets. GATS, General Agreement on Trade and Services. It's the services budgets they're after. Yeah? And a part privatised system is open to competition law, is no longer protected from trade deals, so it has to be fully renationalised before you do anything else. Anything else is a distraction. Simon Stevens, how do we get rid of him? Maybe I'll put that one out to you guys. But I think the key is to make people aware who he is and what he's up to. That's the starting point. Pharmacies, yeah, so we're having a consolidation of every aspect of healthcare. So your local independent pharmacist who's been based in your community, his days are numbered, as is your local GP. And what is happening is they are squeezing the funding, they are moving more stuff online, and you're getting the big players like Boots and Lloyds who donate to the politicians. The scene is being set for them to take over. So that's another battle. I think that's hopefully most of the questions. You got anything to add, Ella?
Yes,
you want the mic?
There's some fresh ones there as well, some new questions.
Sorry. There's two I wanted to address. How do you make this? I'll get my knife up the right way, I can tell you that. There was a question about action, and there was one about how do we get rid of Simon Stevens, and I want to address those questions. The fact is, the NHS, we have to look how we got the NHS to know how to defend it. It didn't come out of nowhere. It came out of the post-war Labour government, which had a landslide victory because people suffered during the war and they fought the Nazis, and they were not going to come back to the hungry 30s, you know, with no pensions, no proper housing, no proper NHS, having to pay for these voluntary hospitals and all the rest of it. And Bevan ran with this, which he did. And he brought his National Health Service, 1948. He nationalised the hospitals, a whole lot. He brought in public sector employees in the hospitals. Even the consultants are NHS employees on national terms and conditions. So all hospital staff are public employees on national terms and conditions. And he brought in a system of national training, in-house training within the NHS. Every hospital had a postgraduate education centre. And the GPs, he tried to get on board, tried to set up medical centres, but at that time they wouldn't have it. But he came to a compromise and he said, we'll give you independent contractor status on an NHS contract. It's not for profit, it's not for shareholders, but it's an NHS contract, and you will supply medical care. And every patient had the right to a GP, which for many women, but pre-war, they didn't have that, nor did they, because they weren't on the panel and so forth, and you had to pay. And not only that, your GP had the right to refer you to a consultant clinic, which had been denied to millions of people before. Free, universal, according to need, to high standard, comprehensive. And it was to be medical led. He said, you professional men know what needs to be done, and in that sense we'll put you in charge. And he had this system of regions. Every region had a teaching hospital, and they were to sort of help train people in the town hospitals. Eventually we got district general hospitals. And nurses had bursaries, didn't they? And were helped to train. I can remember training nurses, and you know, before they got rid of in-house training and so forth. So it was public ownership, public provision, nationally trained workforce, national terms and conditions, Whitley Council. And it was on that basis, and it's only on that basis that you can give free, universal, free at the point of need, universal healthcare, comprehensive according to need. You can only do it with a publicly run service. You cannot do that. Private enterprise cannot do it because it has to make a profit. And that's what drives it. Whereas the NHS was not driven in that way. It was driven for need. And consequently, for those of us that worked in it for years, our ethos was need. The money, well, that came from taxation, and that's the fairest way to do it because the rich pay more, poorer people pay less, and the money's redistributed according to need. So even if you were poor, you could get your kidney transplant or whatever it was, which costs a lot of money, but it was done according in that way. Now, I'm suggesting to you that if we want to fight to keep this system, and it's not completely dead yet, they've got all these moves, but they have to do them behind the scenes and not tell us the truth and pretend they're not privatising it, because if they came out openly and saying we privatise the NHS, no one would get elected. So we've still got a lot of our district general hospitals, despite all the closures. We still, at this present time, have our GP surgeries. We've still got a lot of teaching hospitals. And we've still got a lot of staff, about 1.3 million staff. And the orders of us have very much got that ethos. So we've got everything to fight for. Now, the question is then, how are we going to do that? That's the question of how do we defend this system and get rid of Simon Stevens in the process. Well, I'm suggesting to you that we have to do it along similar lines to how we won the NHS, state education, pensions, public utilities and so on. In other words, we've got to mobilise our class. You know, the Labour, Bevan and these people were fought in the interest of the working class. And he came from Wales and he saw all the miners dying of these awful diseases. And he realised that there had to be publicly provided care from cradle to grave. And he responded to that call and he brought in that legislation. The only thing was we got a sort of wonderful welfare state, but we didn't actually abolish capitalism. You know, and I'm sorry to mention it, but I'm a political person as well as a medical person, and the only way I can see it out is actually to get rid of this rotten, awful system, which is bankrupt, which can only offer us poverty, austerity, and get socialism and a workers' government, and renationalise the NHS, bringing everything back in-house, and restore provision according to need. Now that will take a big struggle, but our allies are out there. There's lots of allies out there because everyone depends on the NHS. So you talk to rail workers, bus workers, cleaners, all sorts of ordinary people. You know, they want to keep this NHS, and we know it's the main political hot potato. When Trump came here, this was the main issue, wasn't it? Defending this NHS. Now the problem is, as Bob so well outlined, it's not just going to depend on new trade deals with the United States. They're doing it from the inside because their man is on the inside. He's here doing it. And it takes the form of a new GP contract, pushing them into networks, integrated care systems, nobody knows what the hell they are, and they're going to end up as accountable care organisations, ICPs. And they will abolish the GP practice. The GP practice. Now, my union is saying, oh, but we're saving the GP practice. They're only going to go into integrated care systems, not integrated care providers. Yes, but the name of the new contract they've signed is Investment and Evolution 5-year contract reform for GPs to implement the NHS long-term plan. I brought 3 pages of that plan and you can read it. The plan is to bring in ICPs, that's HMOs, as Bob described them, which would deny care. And then they may not be tendered out, they might just be given to private providers like United Health, who are floating about in the wings, ready to run them. And under an ICP, a GP has lost his NHS contract. He no longer works on an NHS contract. He would have to work under this contract of an ICP, which is a money-making, profit-making contract. So, you know, the GPs now are very concerned about this. A lot of them don't know. We've experienced that because you talk to them, they haven't read it, they don't realise why they're being hustled into this thing. And I picked up an article today in Pulse magazine, and there are GPs up in Liverpool who say, we're not going to sign this, we don't want this, we want to keep our GP practice. And we must encourage our GPs to hang on to their NHS contracts and their GP practice. And everybody in this room's got a GP, and you must approach your GPs and say, don't join a network, it's not for your benefit, you will be turned into a robot working for United Health or something, and you must go on being an NHS GP and put your patient at the centre of your concerns. So we can do that, but we can talk, you know, we've got to fight in the Labour movement as a whole, and we've got to say that we want to get socialism and get the NHS restored as a public service. And the first thing we've done is boot out Simon Stevens.
Thank you. Right. So, any other questions? Yeah, I saw Kimon and then...
Thank you for an interesting talk, which I agree with pretty much everything you say, and it is out there. People do know about it. Some people anyway stay in trouble. And thank you for that eloquent defence of the last war. Maybe the next war will be the same, but I think you're fighting an analog campaign in the digital world, as they say. My question is, and going to the basis of all these problems, perhaps, in any health system, you could pay an infinite amount of money to keep people alive as long as possible. There's always another test, always another CAT scan, always another pill. The super rich, they go for tests every year to check every electrolyte in their body and God knows what. You can't do that for everyone. In any rational system though, not everyone can have every test all the time. Someone has to decide who gets the treatment. In your ideal world, how would you decide which treatments are and are not available?
So yeah, that's in fact one of the narratives that's commonly used. Aging population, increasing demand, technological advance, we can't afford this. What they're doing is copying a system that's twice as expensive and telling us we can't afford it.
There's always something you can't afford.
Yeah.
And look around this room and there is an aging population.
Sure. Okay, aging population. Irrespective of what age you die, you will cost the most in your last year of life. Whether you die age 30 or whether you die age 99. People are living longer, healthier lives, providing childcare, providing family support, paying taxes, yeah, being active members of society. What we're in danger of falling into is the narrative of, oh, we can't afford it, something must be changed. The reality is, you must do things based on evidence, yeah? There is no evidence for sending people for fancy tests every year. That's the providers gaming the system, doing unnecessary tests. I'll give you an example. Anybody here had a over 40s health check? You unhealthy bunch.
We're too old.
It's a complete waste of time because it attracts the educated middle class who are already low risk. It's a self-selecting group. Why are we doing it? It's a data mining exercise for the insurance companies to set your premiums. It's not evidence-based. Oh, before Drew's passing around an iPad. If you want to register to know when our film's ready, please put in your email. So be careful not to fall into the we can't afford it trap and the undeserving sick, and it's all their own fault. They smoke too much, they eat too much, they drink too much.
I didn't say.
I know you didn't, but I'm pointing out the plausible narratives that will break social cohesion. And one of the most potent is the undeserving sick, and the elderly slips into the undeserving sick. Scapegoating, yeah.
But that's not my question at all.
Well, your question is, I could tell you, if you withdrew the market, which is costing at least £10 billion a year to run, you could double general practice overnight. General practice costs £10 billion.
Are you saying that you could afford anything conceivable, anything medically possible you could afford?
You don't have to. You don't have to. There's a major issue about obesity and how the big food industry works and how big pharma works. We are prescribing statins like Smarties with very little benefit, yeah? But it's driven by commercial interest. If you get the commercial interest out, we could easily afford a healthcare system much better than what we're doing at the moment because of commercial interest. It has toxified everything we do. Guidelines are written by experts who are in the pocket of the pharmaceutical industry. It does not mean it's necessary, so it is affordable. It is affordable. There is no better system, yeah, than the one we currently have. What is the other plausible narrative? Okay, the bucket. The other thing that keeps coming up is, oh, let's put more money in, yeah, into this NHS bucket, right? But there are two big holes. One is PFI, and the other is the cost of the market and the profiteering. If you close those leaks, we'll easily afford it. PFI, the risk with PFI, some people are calling for centralisation of the debt. That's going around activist circles. What that will do, perversely, at the moment, PFI protects the hospital because it has a mortgage. And private companies don't want to buy something with a debt. So they are manoeuvring for the Treasury to take the debt away so that the hospital can be sold to the private sector. What we must do is avoid falling into these traps and look to prosecute some of these dodgy PFI deals that were fraudulently negotiated. LIBOR was rigged. We need to sell, the creditors don't even need to take a haircut. They've already had their repayment. They are cashing up, yeah, getting 8-fold return on what they lent to us. So there are some traps there that need to be avoided.
Thank you. Right, Mary?
Thank you for that really interesting talk. I think we all learned a lot. Could I mention dentistry? Because I'm absolutely, which is of course part of the NHS, because I'm absolutely astonished at the fact, that there's passion and emotion about the NHS, and yes, people do organise, but we've actually lost a comprehensive free dental service without any big campaigns that I can remember. I mean, just yesterday the announcement, I think, was at Portsmouth, where you just cannot get an NHS dentist. Now, would you like to say something about dentistry and what we can do there?
Yeah, so it's, when the NHS was formed, it was free dental care, free maternity care, free eye care, free health care. It was all included. Within a couple of years, 1948 I think, they started to bring in prescription charges. 1950. In 1948, there was the first group formed to break down the NHS. It was called the Fellowship and Freedom of Medicine. Yeah, so the attacks on the NHS started from day one. I think Bevan resigned because of prescription charges. Dentistry gradually got pulled away. And the way the government have funded dentistry, they've made it economically unviable to provide NHS care. Yeah? That's fundamentally it. And the way the fees are structured is it's more economically viable for the dentist to pull your teeth rather than to give you treatment that might save your tooth. So